Hello friends, myself Dr. itishree Pandey, Assistant Professor in Department of Biochemistry, and today we'll be talking about sickle cell anemia. As the name suggests, there is sickle cell, means the RBC becomes sickle shape and which leads to anemia. So the disease is called as sickle cell anemia. We all know that it's a kind of inherited hemoglobinopathy, and to discuss about the basics of the hemoglobin and the hemoglobin S structure, the biochemical basis of sickle cell anemia and the polymerization, and further these polymerization leading to vaso-occlusive crisis and organ damage, and the management of sickle cell anemia. So as we know that hemoglobin consists of heme and globin structure. So heme is what? Basically it is a 4 tetrapyral ring structure. It's a 5-membered ring structure with nitrogen atom. And once these 4 tetrapyral ring structure with iron in the center is what heme comprises of. Now coming into globin, we know that globin comprises of 2 alpha chains and 2 beta chains. Now looking at the structure of hemoglobin, there is iron in the center. There is iron in the center, 4 tetrapyral ring structure and 2 alpha and 2 beta globin chain. So this is about the structure of hemoglobin. This is how normal hemoglobin, adult hemoglobin looks like. Now we know that there are 3 kinds of hemoglobin which are present in humans, and in adults HbA1, HbA is the most dominant form of hemoglobin. HbF is found in the fetus and the other form is HbA2. So in adults HbA is found maximum, whereas HbF is least. Now as I said earlier that sickle cell anemia, it is a type of hemoglobinopathy. So let us see what is hemoglobinopathy. As the name suggests, there is sub-abnormality in the hemoglobin. So this could either be qualitative or this could be quantitative. We call it as qualitative when the quality of the hemoglobin which is produced is abnormal. So these abnormal hemoglobin happens because of the point mutation or single nucleotide alteration, and the example of qualitative hemoglobinopathy are HBS, that is sickle cell disease, which we will be discussing in detail, HBC, or combination of HBS and C, that is HBSC. Hemoglobinopathy can also be quantitative type when the quantity of hemoglobin which is produced is less. It is called as quantitative hemoglobinopathy, and the example is thalassemia, in which the hemoglobin quantity is less than normal and the cause for the same could be either point or deletional mutation. As we know that there are 2 globin chain, so thalassemia abnormality could either be beta thalassemia if the beta globin chain is synthesized in lesser quantity, or it could be alpha thalassemia if the alpha globin chain is synthesized in lesser quantity. Now let us look into the sickle cell anemia. As we can see in the first picture that the normal RBC is circular. Normal RBC is circular, whereas sickle RBC becomes sickled in shape, which is an abnormal form of RBC. Now the question that comes into our mind is, are these RBC always present in sickle shape in sickle cell patients? No. When there is hypoxia or when the blood has, that is when the blood has less oxygen, that is when the circular RBC becomes sickled in shape. Now let us look into sickle cell anemia in detail. As I said earlier, it is an inherited disorder and the kind of inheritance is autosomal recessive. The reason behind is mutation, and the kind of mutation is point mutation, which is partially acceptable missense mutation. It is partially acceptable missense mutation. Now due to this mutation, as I said earlier, the RBC becomes sickled, and this sickling leads to premature destruction of the RBC in the spleen, leading to hemolytic anemia. And due to this frequent vaso-occlusive episodes, which is called as vaso-occlusive crisis, leads to organ damage in patients of sickle cell anemia. So the patient of sickle cell anemia will have more number of hospitalization because of crisis and more morbidity as compared to normal healthy children. As I said about the normal structure of the hemoglobin in the previous slide, now let us look at the abnormal structure, that is the structure of HbS. As I showed earlier that there is 2 alpha and 2 beta chain, which is represented as Hb alpha 2 and beta 2. Similarly, hemoglobin S is represented as hemoglobin alpha 2 and S2 in cases of homozygous state. Now, in sickle cell trait, that is heterozygous. It is sickle cell trait and this is sickle cell disease. So what happens in sickle cell? So what happens in sickle cell trait, that out of the two, only one of the beta chain is defected and one is extremely normal, whereas in sickle cell disease both the beta chain are replaced by hemoglobin S. So this is the difference between the trait and the disease, which is homozygous and heterozygous state, as we can see. Now, where does exactly mutation takes place in the beta globin chain? So basically the mutation takes place in the 6th position. It takes place in the 6th position of the beta globin chain, where glutamate, I repeat, glutamate is replaced by valine of the beta globin chain. Now we know that it is the genetic codon in which if there is any alteration will lead to mutation. So now let us look at the synthesis of protein. So we know that in the DNA undergoes transcription to form RNA, and these RNA undergoes translation to form proteins, that is amino acid. Okay. So what happens in case of sickle cell? We look at the table here. Normally it is in the 6th position of the beta globin chain, it is thymine which is present. So in the DNA it is written as CTC. Okay. And since in sickling this thymine is replaced by adenine, the codon, the nucleotide base which is present, which forms the genetic code, thymine is replaced by adenine, so it becomes CAC. Now CTC, when undergoes transcription, forms GAG, and here in abnormal condition, that is in case of sickle cell, this GAG is replaced by GUG, CTC is replaced by CAC. Now this GAG codes for glutamate, whereas GUG codes for valine. So because of changes in the nucleotide base at the level of DNA from thymine to adenine, and from GAG to GUG, and from glutamate to valine, sickle cell disease takes place. Now what is the characteristic of amino acid glutamate? Glutamate is polar in nature and it is negatively charged amino acid, hence it is more soluble in water, whereas valine is non-polar and has more tendency to precipitate and less soluble. So because of this tendency of valine, the polymerization of the RBC takes place and hence this shape of the RBC changes to sickle shape. Now about the polymerization we will be discussing in detail later. This has already been explained about the types of hemoglobin, about the types of sickle cell disease, that is homozygous and heterozygous, which is represented as HbSS and sickle cell trait, which is represented as HbAs. Now we'll look into the case of sickle cell crisis. So now we'll look at the sickle cell case. Now Mahesh is a 17-year-old boy who came to the hospital emergency room with severe pain in his lower back, abdomen and legs, which began after a 2-day history of nausea and vomiting, which was caused by gastroenteritis. He was diagnosed as having sickle cell disease at the age of 3 years and has been admitted to the hospital on numerous occasions for similar vaso-occlusive sickle cell crisis. His blood report said that the hemoglobin was less than the normal and the hematocrit was 23.4%, which was again less than the normal. Now, what is the diagnosis for this patient and the molecular basis of sickling in the above cases, and the symptoms and the complications of sickle cell disease, and screening and diagnostic test for sickle cell disease, and the fifth is management for sickle cell disease patient. Now, let us look at the diagnosis of this patient. As it said that the patient was diagnosed as sickle cell crisis, sickle cell disease at the age of 3 years. The symptoms exhibit of sickle cell crisis, in which the patient usually complains with joint pain, fever, body aches, and overall immunity gets lower, and hence the patient becomes more prone to infection, and this patient had history of gastroenteritis. Now coming into the molecular basis of sickle cell crisis leading to sickling and pain. Now the normal RBC is circular in nature in oxygenated state. Okay, that is sickled RBC in oxygenated state remains circular. Now in the venous or capillary bed, where the concentration of the oxygen is low or hypoxia, when the HbS undergoes deoxygenation, it leads to sickling of the normal circular RBC. Now this sickling happens because these HbS under hypoxia, under low oxygen concentration, undergoes polymerization into long fiber, leading to sickled RBC, and this sickled RBC consequences to occlusion of the microvasculature and hemolysis. This sickled RBC would lead to occlusion of the microvasculature and hemolysis, leading to hemolytic anemia, Now we all know that the hemoglobin, we all know the classification of protein structure. It is into primary, secondary, tertiary and quaternary, and the example of quaternary structure is our hemoglobin. So what happens in sickle cell disease? In the deoxygenated state, the quaternary structure of the hemoglobin is disrupted. The quaternary structure of the hemoglobin S is disrupted, and the polymerization that leads to disruption depends on the degree of the cellular hypoxia, that is the oxygen concentration present. The intracellular hemoglobin concentration, more the hemoglobin concentration, the lesser would be the effect of the polymerization, and the presence of fetal hemoglobin, because HbF does not contain beta globin chain, and hence there would be less polymerization of the sickle RBC. Now what does exactly happens into the HbS that leads to polymerization? As we know that in the deoxygenated, the HBS, in the HBS, a knob-like structure is created. A knob-like structure is created. And this knob-like structure gets attached to the hydrophobic pocket of one subunit of the hemoglobin molecule. This gets attached to the hydrophobic knob of the hemoglobin molecule. Now consequently this binding goes on as shown in this picture. The first, second, third and the fourth goes on via Valin knob only, and this polymerization takes place until the long fiber formation takes place. Okay, I repeat, in the deoxygenated state there is Valin knob is created, and this Valin knob gets attached to the hemoglobin molecule, to the pocket which is hydrophobic in nature, to the adjacent hemoglobin molecule, and then to this attachment at 45 degree, this third and the fourth hemoglobin molecule gets attached, leading to long fiber formation of polymerized RBC. Now this polymerized hemoglobin aggregates and it damages the cellular membrane. Now that the sickled RBC is into the blood, they aggregate together and damage the cellular membrane. And due to the damage of the cellular membrane, there is aggregation of the membrane protein and cell permeability increases, leading to dehydration. And this affected cell will adhere to the endothelial cell in the capillaries, thus occluding the blood vessel. I repeat that these hemoglobin polymer will aggregate and this will damage the cellular membrane, and this cellular membrane damage will promote the aggregation of the membrane protein aggregation, and hence the permeability of the cell will increase, leading to dehydration, and ultimately this affected cell will adhere to the endothelial cell, leading to occlusion, and this occlusion leads to decrease in the blood flow and hypoxia, which ultimately leads to organ damage. So in sickle cell there are multiple organ damage which happens because of the decreased blood flow. Now what are the clinical features of sickle cell disease? As I said previously, the crisis, patient will complain of fever, joint pain, etc. As the name suggests, sickle cell anemia, the patient will have hemolytic anemia, okay, because in the sickled RBC lead to premature destruction in the spleen, in the reticuloendothelial system. Hence, there will be decreased number of circulating RBC. There would be decreased number of circulating RBC because of the premature hemolysis. Now coming into the symptoms of the sickle cell disorder, the patient will complain of fatigue and decreased hemoglobin, will be more prone to bacterial infection as the patient's immunity is deteriorated. There will be eye damage, the bouts of pain which is called as crisis, pulmonary and heart disease because of the hypoxia. Basically because of the hypoxia only there will be swelling and inflammation of the fingers, toes and arthritis, because these are the present in the distal end. Okay, so because of the hypoxia there will be swelling and inflammation of the fingers, toes and arthritis like clinical picture. There will be thrombosis in the spleen and the liver, and the patient will also present with leg ulcer. So this was about the symptoms of the sickle cell disorder. Now coming into the complication. Now the long-term crisis and long-term polymerization and the sickle state leads to stroke, acute chest syndrome, pulmonary hypertension, organ damage, blindness, leg ulcers, gallstones, DVT, pregnancy complications and also avascular necrosis. Now how do we confirm the sickle cell disease? So whenever there is this, first is the screening test, because it is an inherited disorder, so it will be inherited from the parents to the children, And also it happens big, since it is an autosomal recessive, the marriage of the two recessive will also lead to sickle cell disease. So whenever there is a mass screening program by the government wherein a particular region or religion or a particular caste is to be screened for sickle cell disease, we have sickling test and solubility test for the screening. So what do we do in the sickling test? Now what do? We add the reducing substance, which is sodium metabisulfite 2%, and then this metabisulfate is mixed with blood. This metabisulfate is added to give the deoxygenated state to the RBC. Once it is mixed, the blood mixed with metabisulfite is covered with a covered glass, and the edges are sealed with paraffin. And then after 15 to 60 minutes, the peripheral smear is read on microscope. So as we can see that this is the normal cell, whereas in sickle, the smear will have sickle shaped RBC. Okay. So this is a screening test which is called as sickling test, in which we add sodium metabisulfite 2%. Okay. Now coming into solubility test. This is based on the principle of phosphate solubility. In this, what do we do is saponin is added to the blood. Okay. So erythrocytes are lysed. Okay, and then the released hemoglobin is reduced by sodium hydrosulfide. It is sodium hydrosulfide. Sickling test, we had sodium metabisulfite in a phosphate buffer. Now, reduced hemoglobin S is characterized by its low solubility. Means a patient having HbS will show less solubility. So when put on these straight line, they'll have opacity, whereas normal RBC, the lines will be visible. This is the principle of the solubility test. This is normal, and in sickling the lines will not be seen, means due to lysed RBC it has become opaque. Now coming into the diagnostic test or the confirmatory test for sickle cell anemia. The confirmatory tests are electrophoresis, HPLC, gene studies like PCR, RFLP, restriction fragment length polymorphism, and DNA microarray. So the most common is electrophoresis, whereas the confirmatory we have HPLC. So what is electrophoresis? As the name suggests, electrophoresis means there is movement of proteins. Electrophoresis, that there is movement depending on the charge of the particle. Phoresis means movement, electro means charge. So there is movement according to the charge present on the proteins. So in electrophoresis, there is movement of charged particle from the origin towards the cathode. So as we can see that in hemoglobin, which is of the normal type, it reaches till the cathode, whereas in sickle cell anemia, as the glutamate is replaced by valine, it doesn't go as far, it remains close to the origin. And also in sickle cell trait, as there are both the kinds of hemoglobin present, that is hemoglobin A and hemoglobin S, there will be two bands seen in the electrophoresis. Now there is another diagram to show the same, like from the origin, the nearest one would be HbA2, the farthest would be HbA, and before that will be HbF, and in the center of the HbA2 and HbF there will be a band which will be the band for HbS. So this is how the electrophoresis for sickle cell anemia looks like. Now this was about the test that we do for sickle cell disease. The screening test is for the early diagnosis, whereas confirmatory tests like hemoglobin electrophoresis, HPLC and gene therapy are costly and it is not available at ease. Now coming into the treatment for sickle cell disease. So the first treatment is multivitamin containing folic acid preparations. As we know that the patient is susceptible to infection, the patient has to be given antibiotic, hemotransfusion in some cases, analgesics to reduce the body pain, erythropoietin and intravenous dehydration, because dehydration leads to vaso-occlusive crisis, immunization and hydroxyurea. Hydroxyurea is a drug of choice in sickle cell disease. So how does hydroxyurea effective in sickle cell disease? So looking at the mechanism of action of hydroxyurea, firstly it increases the synthesis of hemoglobin F. The more the hemoglobin F, the less will be the sickled hemoglobin present in the body, and hence there will be more oxygenated hemoglobin into the blood. Second is by inhibition of ribonucleotide reductase, which will lead to marrow cytotoxicity. It also decreases the neutrophil count and reticulocyte count. Also increases the release of nitric oxide, which increases vasodilatation and hence inhibits occlusion and decreases the episodes of vaso-occlusive crisis. So this is the mechanism of hydroxyurea therapy in sickle cell disease. Now coming into a newer drug which is voxelotor. I repeat, it is voxelotor. So what it does, it inhibits the polymerization. As we have seen during polymerization of HBS, that valin knob is created which binds to the hydrophobic pocket in the hemoglobin molecule. So what do we do? What does voxelotor do is it reversibly binds to 1 alpha globin chain within the hemoglobin tetramer in the oxygenated state, and this binding prevents the polymerization of hemoglobin. So this is a principle of voxelotor. Now in recent advances, we have FDA approved first gene therapy to treat the patients with sickle cell disease. It is recently approved and could be asked under gene therapy or as recent advances in sickle cell disease. So as we can see that this gene therapy is called as Lyfgenia. It is called as Lyfgenia. It is a cell-based gene therapy, and every gene therapy requires a vector, and the vector here is lentiviral vector. The vector is lentiviral vector, and it is approved for the patients of more than 12 years of age who are diagnosed with sickle cell disease and have episodes of vaso-occlusive crisis. The principle of Lyfgenia is that the patient's blood stem cell is genetically modified to produce HbA-T87Q. It is genetically modified to produce HbA-T87Q, and it is a gene therapy derived hemoglobin that functions similarly to hemoglobin A. Hence, there would be less deoxygenated HbS in the body. Now there is adaptation for the survival in malaria infested region, and in sickle cell trait we all know that there is only one beta globin chain is abnormal. Only one beta globin chain is abnormal. So it is said that sickle cell trait is an adaptation for survival in malaria infested region, Because Plasmodium falciparum, which is a causative agent for malaria, has a life cycle in RBC, and in sickle cell trait, when there is increased lysis, it interrupts the parasitic cycle. Once the Plasmodium falciparum enters into the RBC, it decreases the pH, hence increases the sickling. Once there is increase in the sickling, there would be lysis of the RBC in the spleen, and hence it will interrupt the life cycle of Plasmodium falciparum. Okay. So it is said that sickle cell trait is an adaptation for survival in malaria infested region. The reason being is that once the malaria enters into this sickle cell trait RBC, there would be increased lysis, and hence the interruption, and hence the prevention